Hello everyone. In this video I'm going to tell you about appendicitis, and basically I'll start from appendix. What is its anatomy, physiology, and then I will go to acute appendicitis, its etiology, pathogenesis, and certain clinical forms and everything that you need to know about acute appendicitis. So appendicitis is basically the inflammation of the appendix, and it can be acute or it can be chronic. So what is the appendix? As we already know that appendix is also known as vermiform appendix, because the vermiform name is given because of its shape. It is worm like in shape, so the vermiform name is given to the appendix, and it is intraperitoneally located, so it is located within the peritoneal cavity. Also, the length of the vermiform appendix is 8 to 10 centimeter, and this is the normal size. It can vary from person to person also, and the thickness is from 0.3 to 1 centimeter. And as you can see here, this is our ascending colon and this is our cecum part. So here ileum will be entering the cecum part, and this little structure here, it looks like a worm, so it is vermiform appendix. So the lumen is covered with the mucous membrane. The lumen of the vermiform appendix is covered with mucous membrane, which is rich in lymphatic follicles. So lymphatic follicular rich mucous membrane, you can say, vermiform appendix is having. And its muscular membrane has two layers basically. One is longitudinal, which is present outside, and one is circular, which is internally present. So outside will be longitudinal muscular layer, and internally will be circular muscular layer. And about its submucous layer, as the submucous layer of vermiform appendix also have multiple lymphatic vessels and follicles also, just like the mucous membrane. So these are just the general, you can say, histology, the layers, structures. So what is the blood supply? So if we see the blood supply of the appendix, it is from appendicular artery. So appendicular artery is basically a branch of ileocholic artery, so it is an end artery. End artery means that if any thrombosis or anything that anything occlusion or any other stuff happens in this artery, then it will result in gangrene or necrosis. It is not attached to any further